Thanks for joining me on a fireside chat today.
Jeff, it's great to be invited and looking forward to this.
You've been a big force in this area. You've been involved in even naming this region. Tell us all about it. What is the BioHealth Capital Region?
Well, the BioHealth Capital Region is Maryland, D.C., and Virginia. And if we go back about 6 years, Jared Borkat was with MedImmune at that time. And he was working with some of their national marketing people. And they said to Jared, we don't have a name for this region or a brand like Silicon Valley or Route 128 or Research Triangle. And they said, do we need one? So Jared went to a number of the leaders within the region, said, do we need a brand? And we basically said, well, why don't we get a focus group together? And they retained their marketing firm, which was their corporate marketing firm out of the UK. And they invited 150 people to meet over a 6-month period monthly to evaluate whether or not we needed to create a brand for this region, Jeff. And over that course of time, basically, people, I could have told them that the name of the brand was going to be BioHealth something, because that's what we started with 11 years ago when we created BioHealth Innovation. But I think it's good when it comes through consensus and everybody buys into it. And the BioHealth Capital Region evolved because, number one, biohealth, I believe, is a little more appropriate than biotech or life sciences these days because of the convergence that's happening. And since you're a Silicon Valley guy, of what's happening with technology and going on in the bio and the healthcare field, and because it's all converging today. And then capital, we used a capital with an A rather than an O. And the reason for that is capital is needed by everybody, but it does have a double meaning when you look at the capital region as well as the need for capital. And then region, the third word, was that we really had struggled over decades here of getting people to work together, crossing county lines, state lines, rivers, bridges, and it's been a challenge in this region. So everybody endorsed the BioHealth Capital Region, which is the full state of Maryland, DC, and Virginia coming together. And that it's an interesting history to the brand, and it's really catching on around the country and around the world, Jeff. We're now the fourth leading biopharma cluster as ranked by Genetic Engineering News, which does an annual ranking every year of the top 10 bioclusters. And we have gone from number 6 to number 4. And we bypassed Research Triangle in San Diego. And originally, they only classified a 5-mile stretch of 270 as sort of the 270 corridor. They didn't incorporate everything around it. They discounted Baltimore. They discounted Frederick. They discounted DC. And we said, we're regional just like Cambridge is, so you have to, or the Silicon Valley is. It's not just one, it's not Palo Alto. It's everything around the valley. So at the end of the day, our rankings have increased because now it embodies everything from a regional perspective that people view as the way we work, sort of within the 30-mile radius of Rockville or Gaithersburg, which is the center.
Yeah, that's very interesting history of this region, and you've been here really from the beginning of it. So BioHealth Innovations was started, you said 11 years ago, is that right?
Yeah, basically.
It's already been 11 years?
Yeah, from an evolution there. I was speaking at the National Academy of Sciences in 2010. David McDonough from Johns Hopkins was in the audience, and when at the cocktail reception, David came over and said, Rich, what you just talked about best practices for biopharma clusters around the world relates to what we've been trying to do in Maryland, and we really haven't been able to get everything clicking and working together. Would you be interested in coming to talk to some of the leaders within our region about what you just discussed at the National Academy of Sciences? And I sure I'd be glad to. So first person he introduced me to was Steve Silverman, who was the head of economic development for Montgomery County when that was embedded within the county government. Mm-hmm. And Steve basically said, hey, Rich, would you like to consult for the county And the reason for consulting is Ike Leggett had formed a task force of 30 executives in Montgomery County about a year before and said, we have all of these assets in the county. How come we're not getting a greater return with more jobs, more tax dollars from all of this life science industry we have in our county? That group of individuals met for a whole year. David Mott, the president of MedImmune, was leading that group, and they published a report, handed it off to Steve Silverman at county government. And of course, all the recommendations from all of these industry leaders were market driven and industry driven, not government driven. So when you hand something that's from industry to government, it was hard for them to translate how to implement it. And so what Steve said to Ben, hey, Bendis, can you validate this recommendations in this report and see what we should really do to take this report and put it into an action item? And that's sort of what happened, Jeff. And I interviewed about 90 people over 6 months in 55 different organizations. And we came up with a conclusion in the final report that, number one, industry was not engaged in our region. And at that time, they were focused mostly on Montgomery County, which has really been the epicenter for this industry. And that meant basically government and academia was driving what was going on in life sciences. And but the beneficiaries were industry, whether it was research or the jobs being created or the people being educated, but they didn't contribute much to the income system other than being insulated in the own priorities of their own companies. And the second thing is that basically everything was happening in one county, Montgomery County, whereas this was really a regional ecosystem. But people were, when I first came down here to talk, it was funny. I was talking to some people in Baltimore and they said, "Where'd you go to school?" And I thought they wanted to know where I went to college, and they wanted to know what prep school I went to in Baltimore, Jeff. And basically that's how parochial it was. It wasn't really, people working together because of what you had done in college or your career. It's people got together in their own little cliques based on the prep schools they went to in high school. And that's sort of similar in Washington, D.C. If you think about the nature of Washington, D.C., it's mostly prep schools and private schools because of the eclectic nature of all the people we have in our backyards. And so at the end of the day, and I'll make this a little shorter, in July of 2011, 30 executives met in Human Genome Sciences boardroom. I presented the final findings of this consulting report and said, in order for all of you to work together and for Ike Leggett with his vision to get more return on investment from all of the assets that are in this county, you need to create a private-public partnership that's led by industry, not led by academia or government. And that's how BioHealth Innovation was created. And I also said it needs to be funded by the members of this community, primarily industry, the leading academic institutions, not totally funded by government, like a lot of the economic development organizations are, because if industry doesn't have any skin in the game, they're not going to really be committed to it. Same thing with academia. Generally, academia is a recipient of funding, not contributing funding. So, and it was funny. I made this presentation, Jeff, and there was total silence. Everybody's shaking their head like this. Yes, we need to do this. Wow. And then I said, in order to do it, you need to fund it for 3 years, because you don't want the team, if you create a team, out there perpetually fundraising to raise an organization when they should be doing programs to get people to work together. Yeah. And it was dead silent. And I was waiting for someone to speak. And the first person to speak and actually stood up was County Executive Ike Leggett, not somebody from industry. And he said, "Hey, Rich, this is something I believe I want it to be a part of my legacy. Montgomery County will put $500,000 a year in for 3 years if we can match and exceed that amount of money from all of the other participants in this room." And then all of a sudden, Human Genome Sciences, MedImmune, Adventist Healthcare, people start raising their hands. We're in. But guess what? you would have thought an industry-led initiative would have been led by industry, but it took an entrepreneurial county executive, Ike Leggett, to get this thing going.
Yeah. And then at that point, he put the screws to you immediately to make you head of it. Did he like insist on that? He said, "Hey, this was your idea, Rich. Now you got to come in here and make it work for me." Or did you volunteer for this job?
No, I'll tell you what happened. I was at a stage of life 10 years ago, Jeff, that I was sort of contemplating retirement because, we won't say how old I am, but
Well, never mind that. I mean, you also were in a position to retire. You'd had many successful ventures in the past. I mean, you must have been excited about this if it drew you back into,
right.
Working this kind of effort again. And
I wasn't looking for a full-time job
in this pivotal spot.
I mean, you're right on. I wasn't looking for a job, and I didn't need a job. And I was actually living in Philadelphia at that time, and I was commuting down to assist this evaluation on the train and stay at the Marriott Hotel over in Rockville. But at the end of the day, at the end of that meeting, it was said, well, basically, if we agree that we need to create this entity that wasn't named at that time, it's going to need an interim leader because no one's going to invest in it unless you have someone to lead an initiative. And then they said, well, hey, Bendis, why don't you consider doing this? And I said, no, number one, I'm not interested in relocating right now because I have multiple locations around the country. Number two, I don't need a full-time job. And number three, I think what you should do is create a search committee to go out and find the best person to be the CEO for this organization on a long-term basis. And they said, okay, we agree with you, but why don't you become the interim president and be a member of this trick and be the member of the search committee? And at the end of the day, I acquiesced. I agreed to it on certain terms, Jeff. And then here we are 11 years later, and I'm still CEO of BioHealth Innovation. And the only reason I'm here, and the only reason I took it initially, was I had a chance to do things all over the United States and 26 different countries around the world. And I never had been in an ecosystem that had more potential, more assets, that was more disconnected than this region was at that time back in 2010, 2011. And everybody wanted to create the next MedImmune or Human Genome Sciences. And you know how that is. You're building a company yourself, and if you had a couple $1 billion and you had 15 years, you could do that. But at the end of the day, on in this region, though, there were so many assets, and you have the number one leading research university in the world in Johns Hopkins. You have the University System of Maryland with another $1.3 billion in research dollars. Between them, $3.5 billion a year. And then you have 78 federal research institutions in Maryland, which is more than any other region in the United States or state. And they get $16 billion from the federal government annually. So between the federal institutions and the universities, that's $20 billion. And that replenishes itself on an annual basis. And so really with NIH here, FDA, CMS, Center for Medicare Services, and HHS, if you wanted to do research on some of the highest research in the world with some of the best scientists, you have 6,000 of them at NIH and 27 different institutes. If you want to go through the regulatory pathway, you have the FDA, which is the most the most sophisticated regulatory body in the world for this industry. If you want to determine whether or not you can get paid for your product by Medicare or Medicaid, you have CMS located in Baltimore. And then if you look at healthcare policy and major government programs to fund this industry, you have HHS in DC. So, I mean, you basically, from a government perspective, had all of the assets. From an academic standpoint, some of the top scientists. And then in addition to that, just in Montgomery County alone, 500 companies. but none of that was connected. So that's what enticed me to say, let's take a run at this to see what can be built, because I can't lose, Jeff. I
Yeah.
mean, when you have all of that raw material to work with, how could you fail?
Oh, I think you're underselling yourself. Okay, look, you're preaching to the choir in terms of this region, right? This is a fantastic place for biotech, and all that money that you mentioned, of course, and the Human Genome Project, and just a tremendous momentum in the gene and cell therapy area, which is really the future of medicine. Yeah, I think you are absolutely right about the potential of this area, but I think that you're really underselling that you were the man for the job. I mean, your background was just perfect for this. It was a match made in heaven. That's why they, picked you out, I believe. And that's why you haven't been able to extricate yourself from this job. You know everybody in the region, but even more than that, you have an amazing background in high tech, biotech, and entrepreneurship. Share some of that with me.
Oh, thank you, Jeff. You're too kind. It always takes a village, and we've really been blessed with what we put together as an excellent team of individuals with BHI since it's been created. But, just going backwards a little bit, I grew up in what I'd classify an entrepreneurial family, even though it wasn't technology. Mom and pop grocery store, then they got into the motel business, and those are small businesses, but you still had to be entrepreneurial. And this is all post Second World War, where everybody's struggling to figure out what they wanted to do. And of course, I'm a baby boomer growing up in that environment, so it was very interesting. And I started out with large corporations, I think somewhat like you did, Quaker Oats, Polaroid, Texas Instruments, Marion Laboratories. In Kansas City, I had moved all over Philadelphia, Pittsburgh, Cincinnati, Indianapolis, Kansas City, and moved a lot in my early corporate career days. And then eventually ended up in my first entrepreneurial environment with a healthcare service firm that was called Kimberly Nurses. And we basically had temporary staffing and home healthcare agencies around the United States. And I came in to assist the founder, who wanted to take this company, which was entrepreneurial, and it was a threshold company in the Harvard business terms, meaning that it had gone as far as it could go with entrepreneurial management and needed some professional management to take it to the next level. I was recruited to come in, and a year after I came in, I had just been named president of this conglomerate healthcare service firm that had 125 offices, 10,000 nurses, and 4 different divisions. Wow. And a month after I was named president, the founder of the company died. And so I ended up becoming chairman of the executive committee. His wife and 2 brothers inherited the business. At that time, I had no equity, Jeff, and it's an interesting environment because I helped them after a year sell the business. And without having equity in it being a family-owned business, I made a great deal of money for them, but personally did not significantly benefit from this. Wow. But they gave me $50,000 to sell the business, and they made $36 million on the sale.
So, but the experience, Rich. I mean,
the experience was fantastic.
That's priceless, right?
Yeah. So, I mean, fortunately, I had an investment banker in our board there, and he said, "Hey, I got another deal for you, Rich. We'd like you to run this other software company." It was a healthcare software company, and basically doing pharmacy systems or turnkey for hospitals. I also had materials management, and I went in as the CEO, chairman of the board, and took over running the company in 1983. It needed capital. I put some of my own money in. My wife loved it because I did a second mortgage on my house to invest in this company.
That. I know my wife always is excited about that sort of thing.
Yeah. Very excited about that.
They hate security.
Yeah. And, we were very fortunate from a timing standpoint. We raised venture capital. within about 3 months. We took it public in 6 months on NASDAQ and sold it 2.5 years later. And so with that, basically had the ability, it was a cash deal, and I cashed out, was about 39 years old at that time.
Wow.
And decided, what am I going to do next? So I created RAB Ventures, which was Richard A. Bendis Ventures. And at that time, I called it a venture capital firm. But the amount of capital I had under management, what I really was a super angel before I even knew what the term was. Because I was managing my own money, investing in technology and life science deals, did that for about 8 years until my wife said one day, do you just write checks or do you ever get anything back in return for what you write those checks for?
Are you married to my wife? Because I'm telling you, she sounds just like my wife.
I think wives have that a lot in common. And, you know, it's one of those trust me things. Trust me, dear.
Yeah.
I know what we're doing. And, but and how I got sort of into this economic development world, which is not something I had intended to do, is when I was running my venture capital firm, the governor of Kansas approached me. They were creating a technology-based economic development organization in the state, and they were putting a board together. And he asked me if I would be willing to serve as the chairman of the board when they were just forming this in 1987, Jeff. And this is 10 years before TEDCO was created in Maryland. And this is a few years after they had created the most prolific organization like this in the country, which was the Ben Franklin Technology Organization in Pennsylvania. So we tried to model what we were doing in Kansas, and we recruited a president, and I was chairman for several years. And then ultimately the president left, and guess what they did? They said, well, you're the chairman. Why don't you be the chair of the steering committee to look for a new president? And then in the meantime,
right, interim,
why don't you be the interim CEO for this Kansas Technology Enterprise?
And you didn't see it coming when Ike Leggett did the same thing to you? I mean,
well,
fool me once, right?
So, yeah, fool me once, but you can't fool me twice. But, you know, I guess I'm very gullible. And I ended up doing that for a year, ran it out of my office in Kansas City, because the office for this was in the state capitol in Topeka, Kansas, and then ultimately ended up doing it. And so, but I said, I'll do it under one condition: as long as I can continue to manage my investment portfolio, continue to help other struggling economies around the United States and around the world in forming their ecosystems. And I did that all the way up until 2001. And then what happened was the president of the University of Pennsylvania called me and basically said, we're trying to build an ecosystem in Philadelphia. And we have a private-public partnership that we want to create. They had a search firm, and they basically said, we'd like to have you come to Philadelphia to build an innovation partnership.
Philadelphia. What year was this?
This was in 2002.
Wow, that was a very hot time for that area, actually. This is sort of the beginnings of that as well.
That was the beginnings of that. And, you know, the search committee was what impressed me. Brian Roberts, who's the chairman of Comcast, Governor Tom Ridge, who ended up being the Department of Homeland Security, J.P. Garnier, who was the chairman for GlaxoSmithKline, which had their headquarters in Philadelphia, and the president of the University of Pennsylvania. And, you know, that was sort of a wow search committee. And, you know, over 6 months of negotiation, I eventually decided to do it. It was hard to leave Kansas City. All of our kids were raised there, and my wife's infrastructure was there. And I went down one day to say to my wife, I was on a Saturday morning call with, her name was Judith Roden, president of Penn. And I said, it looks like we're going to Philadelphia. And she says, it looks like you're going to Philadelphia as long as we keep a home in Kansas City.
And you're welcome to come back and visit as often as you like, Rich. Yeah. Oh, wow.
Anyway, I did that. And, you know, to be honest with you, I did commute almost every week for a whole year back and forth. But that was building a private-public partnership, which was really interesting. It sort of has a similar dynamic to this region because it was southeastern Pennsylvania, southern New Jersey, and northern Delaware. Mm-hmm. So you had 3 states, you had bridges, you had the state lines, county lines, and everything else trying to get an ecosystem to work together. And so it was half life science and half technology. So, but we really had the benefit of having a world-class board. We created some investment funds. I was an investor in those funds, but we also had an angel fund with 89 angels that we formed. And we hired a venture capitalist on staff. We had the benefit of having Wharton MBAs be the analyst that would come work for us in Philadelphia. I mean, the talent, educational talent was unbelievable. And did that for several years, Jeff.
I've
And
seen a
so
lot of common threads with things that you've implemented in this region.
this is sort of the third time in this economic development world. I never looked at myself before as an economic development professional, but that's what you get pigeonholed as, even though you're an entrepreneur and business person or venture capitalist or investor or whatever. Yeah. We're really doing God's work in economic development. And I think what has benefited this region is that we've been able to take advantage of some of those things that worked well in other parts of the United States or the world, apply them here. And the other thing I also learned in first coming here, Jeff, is that if you really want to work well together, don't create programs that compete with the other people who exist in your neighborhood. Meaning, we did an analysis of what TEDCO did, the Tech Council did, Virginia Bio did, and everybody else. And we wanted to make certain that BHI would be value added rather than a competitor to the existing ecosystem. And we still are that today. We try to do things differently than what other people do, and we try not to create or get step on the toes of the other professionals who are also doing good work in the region.
Look, I'm learning so much here today about your background, and I can really see the momentum of, your arc, and then you created the BioHealth Innovation entity, and you started going out there and developing a lot of ideas around this region. And you also posted a number of very high profile early successes. I bumped into you in the investor community, even though BioHealth Innovations is, sort of more of a consulting firm. I've seen that you've brought in a tremendous amount of talent like you did in Philadelphia. You've tapped all of these entrepreneurs in residence, these really high profile folks, very successful, well-educated, well-experienced people to be, a foundation element of your relationship with a lot of these different firms that you brought in and coached. And you propelled some amazing things off of that platform. I mean, tell us what you do at BioHealth Innovations to help companies be successful, and tell us about some of those successes.
Yeah, I think, thank you, Jeff. We have some unique programs that are generally one of a kind or unique in their own way for the region. And we identified that by doing the analysis over 10 years ago to say what is lacking that needs to be fulfilled by some organization. And one of the first ones that we created was our Small Business Innovation Research Assistance Program, SBIR. How do companies in our region who were underperforming get federal funding from a $4 billion pot of money that grows every year within the federal government? And people who don't know about it is that any federal agency that does over $100 million a year in their research budget has to allocate almost 5% of their budget for small businesses. And that small business money goes into the SBIR program. And if you just look at that with the NIH by itself, it's about $1.2 billion right now. And so since we're really talking about the biohealth industry, we've worked with about 180 companies, go after SBIR grants, as well as some of the Maryland grants, which they have the Biotechnology Investor Tax Program, which has been very beneficial. They have a Manufacturing Innovation Program, MIPS program at the state of Maryland. They have a stem cell research program. In addition to the federal programs, we help people go after some of the state and local programs as well. And overall, we have a 51% success rate in the companies we've worked with in the grants that they've gone after, both the state and the federal programs. The traditional win rate is about 21%. And the reason that's been successful is we do have a benefit of getting to know the program managers for all these programs that are right in our backyard and managed here. Every institute at NIH has a program management team for the SBIR program. We hold webinars with them together. We get to meet with them personally. They get to know the companies we're working with. Just a few of the success stories that we've had with some of the companies within the region. Miracule, Anthony Sala,
Yeah.
who was an NCI postdoc and researcher, licensed technology from NCI, has been very successful in raising angel capital, pre-seed capital. And he was just notified last week that he got a $3.7 million grant from the NIH, in addition to $2 million he had won previously. So if you're an equity investor, which I know you are, and I am, one of the things that's very nice is to see, several $1 million of non-dilutive capital coming in. And the beauty of this program is you don't have to pay it back. You don't have to mortgage your house. You don't have to give up any equity in your company, and it doesn't dilute your cap table in these growing biohealth companies. And venture capitalists and angel investors love non-dilutive funding. So he's a really neat success story, because it shows also that we have several thousand postdocs in this region, and we want to retain as many as we can. And sometimes they just need a chance. So he came into work 50% of his time with BHI while he was sort of on loan from the National Cancer Institute, and then gravitated to where he ended up being a full-time position. He helped a Dutch company that had an organ on a chip technology called Memetis. We helped them form a U.S. subsidiary here in Montgomery County in 2013. He's helped them raise $4.5 million of non-dilutive SBIR money. They've done a Series B for about $25 million. They're getting ready for a Series C for $50 million. They have 90 people over in the Netherlands. They have 10 people over here on Quince Orchard Road in Montgomery County. And they're going gangbusters. They have an Asian presence in Japan. They have their American presence in Maryland, and they have their European presence in the Netherlands. And BHI has played a major role in helping them grow in the United States, as well as giving them additional credibility with their Asian and European markets because of the American presence that they have. Another company you might know is Murat with Cartesian, CAR-T and cell therapy company. He's raised about $6.5 million worth of non-dilutive funding, but he's raised over $100 million in venture capital with some of the top tier venture capital firms. And, some of the things that we've tried to do, Jeff, as you know, for capital creation we're getting ready for our fourth year for the BioHealth Capital Region Investment Conference. We've done that with JP Morgan and with Wilson Sonsini, and I know AGT has participated in that. You've had a chance to meet some people through that investment conference, but we've had some companies have some major wins with connections with angels or VC firms that they otherwise would not have met if they didn't have that ability to go to that conference. And also one last thing that we do have created is the BioHealth Capital Region Forum. This year will be the 7th year. We normally have about 1,100 people attend it. It generally is in person at AstraZeneca MedImmune, but unfortunately last year it had to be virtual. This year in September, it's going to be virtual again because AstraZeneca is not going to let large audiences into their facility probably until 2020. But that's become sort of a nice meeting point for people to connect. The nice thing about it is we don't charge anybody to attend the event. So everybody attends for free, and that's because we have some very gratuitous sponsors that help sponsor the event to cover the cost so that everybody gets to attend that event for free. So those are just a few of the programs that we've been involved with. And the last one, without belaboring this, is the Entrepreneur in Residence program. We've had that with NIH now since 2013. It's grown from 1 EIR to where we will have 11 entrepreneurs in residence. And the beauty of that is these are people that do not want to be federal employees. and the federal government can't afford to pay them what the market rate would be. But they really want access to the business development, the strategic partnership, the venture capital, the entrepreneurship experience these people have, which they can attract into the federal government. So they actually work on BHI's payroll under contract that we have with NIH. And, we have some fantastic people with experiences that have been with Medtronic or Cardinal Drug or Life Technologies or Covance, or one of our recent EIRs has worked with the FDA 12 years with unbelievable regulatory experience. Another has written and authored books on health economics, on how you price your products and technology. So, the people are so talented, and we're so fortunate to have them affiliated with BioHealth Innovation and our region, so that other people within the region can take advantage of these fantastic resources.
Yeah, I've met some of them. They're terrific, and I know you keep adding more and more people. And it seems like getting a relationship with BioHealth Innovations is giving you a tremendous amount as an entrepreneur of coaching and guidance, and you had numerous successes off of that platform. It begs the question: what could we do in this region if you say you had 50 or $100 million to toss around like a VC? I've always thought you were one of the best VCs I ever met, but no funding. And I also know that you have made small investments along the way and done some in-kind stuff. And I've actually invested in one of the companies that you invested in, and I did very well at it, but you did even better. When can we start investing in a fund that you will go ahead and manage, and let us ride alongside your vision for these upstarts?
Hey, Jeff, you're such a great setup person. Uh, yeah, it's almost like we've talked about this before.
Yeah, spoiler alert, right?
Yeah, spoiler alert, right. But, in addition to our nonprofit 501c3, BHI has always had a for-profit subsidiary, BioHealth Innovation Management. And in that subsidiary, we've had numerous programs where we had the ability to take advantage of earning equity in companies, which we gained several ways. First of all, we did some accelerator programs in partnership with Johns Hopkins in Baltimore. And as a result of having these companies compete to be in the accelerator, to get a few dollars, $50,000, they had to give up certain equity to the sponsors of that. And BHI was one of those sponsors. So we earned equity in those companies. And one of the companies you and I both had the ability to share in was ProTennis. They came out of Johns Hopkins with healthcare cybersecurity software to help protect medical records within the hospital environment. And they've done a series A, B, C, and they just saw this week they closed a D for $21 million, Jeff.
Wow.
So they're still on a roll right now, but they had the ability to buy us out of our equity last year, and it was a fantastic return for everybody. But also another thing we do is we provide services for equity to companies. One of those was Benavir. Matt Mulvey, who had an oncolytic immunotherapy company. And one of our EIRs, Rom IR, you might have known Rom, was one of the EIRs that worked with Matt Mulvey and his wife, Katie. And they had a chance to grow a very successful business. We helped to introduce them to J&J at the Janssen division. 2018, I think, Janssen made an offer to acquire them. And they acquired them for a total valuation of about $1 billion, with an upfront payment of $140 million, and with several milestones to be met. And so BHI had a chance to get sweat equity in that deal. And here's the unfortunate part when you talk about having a venture capital fund, Jeff. Basically, BHI had X percent equity, which I will remain, quiet. But at the end of the day, they got a Series A investor from a venture capitalist. And as a result of that Series A, BHI could not co-invest with them a nominal amount of money. And we were crammed down to about 1/10 of the amount of equity that we had when we earned that equity for the services we provided to Matt and Katie.
Yeah.
When they exited, we got a nice return. It was over $1 million for the first payment, but it could have been 10 times as much if we would have had a small venture capital fund to protect our equity interest we had in that deal. And that's happened to us 3 other times. And so as a result of that, we've decided it's time to form a fund. We're in the process of raising a BioHealth Capital Fund, which would be $50 million. Andrea Alms is going to be a managing co-partner in that. Our lead investor is Alexandria Real Estate Equities, who owns about 3.5 million square feet of real estate in Montgomery County and 30 million square feet nationally, but has been the leading life science investor in America the last 3 years. And a lot of people don't know that. Yeah. They've done more life science investments, not the most dollars, Jeff, because they're a public real estate investment trust and can't own more than 9.9% of any deal. Mm-hmm. So they're limited, but they have done more life science investments in America than any other venture firm. And 50% of the deals they have done have not been in their real estate. So Joe Marcus is on my board of BioHealth Innovation. He is committed to be the lead investor. Wilson Sonsini has a partners fund in their law firm. They're going to be an investor in the fund. We just recently got a family office from Monaco that's going to be an investor in the fund. And Andrea is going to one of the largest family office meetings in the world in Monaco next week, actually, between the 28th and July 4th. And is going to meet with family office managers from all over the world. So we're excited. We think we might be at the cusp of getting to the point where we could have a first close within the next 90 days of the fund and start investing real dollars in these companies where we think there are tremendous opportunities that we have not had an opportunity to invest or protect our investment in.
What's your target for the size of that raise or that fund?
Well, 50 million would be the target size, which we think is the right size, because 500,000 to 5 million is really the gap that exists within our region. Mm-hmm. Look at some of the Series A's that people are raising right now of 20, 50, 75, 100 million. But really, if you could get somebody $500,000 to $1 million and back it up with another $500,000 or $1 million, you can get them to that level to where they could be at that Series A stage, or, do a couple pre-seed fundraisings with a couple of other investors to get that $5 million round. And we think that's the sweet spot that really has been lacking, not just here in our region, Jeff, but it's really a sweet spot all over the United States. Yeah. Even in Silicon Valley and Boston, there, people want to do big deals. It takes as much time to do a $50 million deal as it does a $500,000 deal. Yeah. So the larger firms have more money. They're doing bigger deals. The average Series A deal last year was between 15 and 20 million. And for those companies that are trying to raise in our BioHealth Capital Region, a couple $1 million to get them down the road. And as you know, you're very resourceful with AGT. The amount of money you raised and how as far as you've gone, if you were in Boston and San Francisco, it would have taken 3 or 4 or 5 times as much money to do what you've accomplished. So congratulations on getting to where you are with AGT at this point.
Oh, thank you. But let me ask you the question that's going to be on everybody's mind. How do we get into this fund? Who do we call? Where do we write? If we want to take a piece of that 50 million, and given your track record, I'll personally say you have a tremendous ability of picking companies in that phase. I've seen you do it before, and that's a highly leveraged investment. When you talk about putting in, $500,000 to $1 million at that stage, you get a good chunk of equity. And for the companies that are successful, especially if you don't run into that, same problem with, getting crammed down because you have a fund or you have, a syndicate that you can go to and make sure that you maintain your shares. Wow, kind of the sky's the limit in terms of what can be done. So, do they contact Andrea or?
Well, basically, Jeff, they can contact myself or Andrea Alms. We're very easy to find. Also, if you've got friends, you can call Jeff Galvin because Jeff knows how to find us.
You bet.
Yeah, and so we really think the moons are aligned over this region right now.
I
And
couldn't
one of the
agree
things
more.
we didn't talk about is the warp speed money that came in for vaccines. There was $16 billion they put in to people around therapeutics, vaccines, and diagnostics to treat COVID-19. 40% of the $16 billion came into one county in the United States, and it was Montgomery County, Maryland. So,
Mhm.
I mean, people are recognizing now, and you see Dr. Fauci on TV basically multiple times a day, which is at the National Institute for Allergy and Infectious Disease, which is right in Bethesda, Maryland.
Yep.
You have the accelerated approvals that they've been doing for vaccines and drugs over at the FDA. I mean, and you look at Novak's hotter than a firecracker that's been going on. GSK is one of the largest vaccine manufacturers in the world. And of course, AstraZeneca has been involved in this as well.
Hmm.
So if you look at everything, Jeff, this BioHealth Capital Region is really hot right now. The moons are aligning over it. That's creating opportunities for spin outs from some of our existing companies
Yep.
and also giving more visibility to some of these companies within our region that otherwise wouldn't even be noticed. And we're actually becoming a destination region rather than a flyover or a drive through region, just because of the quality of some of the success stories that have emerged here recently.
Yeah, I think that story about the Netherlands company really shows you that this is a great location for global expansion. And, 3 airports in this area, lots of international flights, easy to get all over the US. I think more and more international companies are seeing this area, the biohealth capital region, as being a place where they need to have a footprint. And you see also companies like Gilead, when they decided, where are we going to put Kite? They put them up in Frederick.
Right.
And, this is, I think, part of to drink from the font that you're talking about. There's a tremendous amount of resources here, and this is a great location for technology, and especially companies that have money for expansion.
Yeah.
This is a
But
go-to location, isn't it?
well, you mentioned the international, and I think the international opportunities for our region are unparalleled right now. One of the recent successes, Ellume, ELLUME from Australia,
Hmm.
developed a home COVID-19 test. The Department of Defense loved that test. They said, we want to make it available to Americans, but if we're going to make it available to Americans, you have to set up a manufacturing, distribution, and research and development facility in the United States.
Hmm.
So one of my board members, JLL, Pete Briskman, which has got a national commercial real estate firm, and he's responsible for this region, actually got the account and showed them sites all over the United States. And we got down to 3 finalists. One was in Dallas, Texas. The other was Atlanta, Georgia. And the other was in Maryland. And they made an announcement last month that they're going to be in Frederick, Maryland. They're taking on 189,000 square feet. They're going to add up to 1,500 new jobs
Hmm.
in this region. And so it basically demonstrates what you're talking about. And another thing on a smaller scale, BioHealth Innovation has entered into a contract with South Korea at this point. They want to train 5 companies that are high potential growth companies in South Korea in the biohealth industry that want to enter the US market. So we've put together a 20-week training program for these 5 companies. We interact with them 2 times a week. We have mentors assigned to them. We have outside speakers come in and talk to them. And that might be an opportunity for a couple of them to land within our region based on this experience we're having with them. We're working
Hmm.
with a UK company, an Italian company right now. And we just think a lot of people feel that this is a great alternative to Boston and San Francisco. Number one, the lease rates or construction rates are 50% of what you would be spending in New York, Boston, or San Francisco. We
Hmm.
have the highest concentration of PhDs and masters of people in the United States in our region. The quality of life is excellent within the biohealth capital region
Yeah.
compared to some of these other cities where it's so hard just to make enough to live and establish a moderate income and moderate lifestyle in some of these high priced cities right now. And we're still very affordable. You talk about the transportation opportunities to get in and out of here. And really, it's just the quality of education public education in this
Yeah.
region is fantastic. So I just
Maryland
think,
invests so heavily in education. They have an incredible state school system. And Montgomery County, especially right here where this industry is growing out of, has made huge investments in campuses and educational facilities and has some of the best schools in the nation. I mean, that is, I'm glad you brought that up. And I'm also glad you brought up the lifestyle because I come from Silicon Valley and I thought I was really going to miss it. And I got to say that every once in a while I miss the weather in Silicon Valley, but that's it. I love the lifestyle around here. This is just a great place to live with, a great community and, it's just really very comfortable for folks that are doing this type of entrepreneurial activity, business, or even social,
yeah.
for
And you know
social
what? I want to
reasons.
compliment you because um, people don't know how often you speak in the community, and you'll go speak to high schools, elementary schools, or whomever it is to talk about STEM education, what's going on with AGT. You've become a great ambassador for the BioHealth Capital Region because
Thanks.
you're ever present, never a negative word being said about the region, and there isn't a different level within the community that you're not willing to talk to, regardless of whether they know anything about this industry or not, or regardless of what age they are or what educational attainment. You are just a great ambassador for what's going on within the biohealth industry.
Yeah, you're too kind, Rich. I think both of us are big cheerleaders for this area because we just believe in it. We're speaking from the heart, and I always enjoy hearing you talk about all of the, amazing resources in this area and amazing opportunities. I love hearing you talk to folks about how to build a company and seeing you coaching, some of these new entrepreneurs. As a final question here, I want to make sure we don't miss this. We need to know how to get in touch with you. We need to know the website. We need to know how to get on your radar screen if it's a company out there that would like to get this kind of coaching. If they're in the right phase where they might be able to get adopted by BioHealth Innovations, they could join a lot of other good companies that have gotten quite a nice launch off that platform. But also, this it's really intriguing that you guys are kind of migrating into the VC space. You have a very unique proposition when it comes to all the expertise, guidance, support, connections, and now money. How do people get on your radar screen?
Well, thanks, Jeff, for the lead in for the commercial. And basically, the other thing that I forgot to mention is that if people want to learn about the region and some of the leaders who are helping drive this region, I've got a podcast called BioTalk, which Jeff Galvin has been a guest on twice and will not be the last time. But if you really want to learn about some of the people who are really changing what's going on in this region, that podcast, which are all on our website, the BioHealth Innovation website is www.biohealthinnovation.org. And if you want to learn about what BHI does on that website, there's a drop down section called About Us with an intro PowerPoint. That intro PowerPoint will talk about all of the different programs we have. If anybody wants to get a hold of me personally, it's rbendis at biohealthinnovation.org. And we're willing to talk to just about anybody. And we're trying to increase our client base now of additional companies within the region we can support, as well as we have some new bandwidth with some new people we brought on recently to help more companies go after some of this non-dilutive funding. So if you're in the search coming for some non-dilutive funding, there's a big call NIH is going to have in September. It doesn't leave a lot of time right now because we're almost in July, but you should be taking a look at that to see if you can get some proposals into NIH soon. But we'll be glad to talk to anybody. And if we can't help you directly, we'll try to direct you to someone that may have some resources beyond what BHI has to support you.
That's terrific. Rich, thanks for all you do in this region to encourage the economic development. I didn't mean to cubbyhole you as an economic development guy. I don't see you that way. I just see you as an inspirational entrepreneur who's now out there and helping other people realize their aspirations and their dreams to build companies around great technologies in biohealth. And thanks for being on this broadcast today. What a great first fireside chat for AGT to have you on the program. I really appreciate you joining me today.
Well, thank you very much for the opportunity, Jeff. Always enjoy dialoguing with you, and it's interesting to be on the reverse side of these chats. A little more uncomfortable, but glad that we could be on your first fireside chat.
Well, you're a natural, Rich. Let's do more of these.
We'll do it. Thank you.
All right. Thanks.